The silent killer, destroying your kidneys right now, and you have no idea. Your kidneys are dying right now, and you have absolutely no idea it's happening. While you go about your daily routine, feeling perfectly normal, this invisible threat is systematically destroying the organs that keep you alive. The most terrifying part isn't just that it's happening, it's that this silent killer has already affected over 37 million Americans, and most of them still don't know they're victims. In the next few minutes, I'm going to reveal exactly what this threat is, how to detect it before it's too late, and the simple steps you can take today to protect yourself from becoming another statistic. I'm Dr. Marcus Elder, and in 25 years treating thousands of patients over 50, I've watched perfectly healthy men and women come to me with swollen joints, constant fatigue, brain fog, and kidneys that are quietly failing. I'm a geriatrician, a doctor who specializes in aging, and for over 25 years I've helped seniors reclaim the strength they thought was gone forever. James was 68 years old when he finally went to the doctor for a routine checkup. He felt fine. A little tired, maybe, but who isn't tired at 68? His doctor ordered standard blood work, the kind you're supposed to get every year, but James hadn't had in over a decade. 3 days later, his phone rang. "Mr. Thompson, we need you to come in immediately. Your kidney function is at 18%. James was confused. "What do you mean 18%? What's it supposed to be?" "Between 70 and 100%, his doctor said quietly. "You have advanced kidney disease. You're approaching kidney failure." James sat down hard. "But I feel fine. How is that possible?" That's the terrifying truth about kidney disease. You can lose 80% of your kidney function and feel absolutely nothing. No pain. No obvious symptoms, no warning signs, until suddenly, you're facing dialysis or transplant and wondering how you got here. I'm Dr. Marcus Elder, and in 25 years treating thousands of patients over 50, I've watched perfectly healthy men and women come to me with swollen joints, constant fatigue, brain fog, and kidneys that are quietly failing. I'm a geriatrician, a doctor who specializes in aging, and for over 25 years I've helped seniors reclaim the strength they thought was gone forever. I need to tell you something that could save your life. Most people walking around right now have early kidney disease and have no idea. According to recent studies, 1 in 3 adults over 60 has some degree of kidney impairment, but only about 10% of them know it. Why? Because your kidneys are silent sufferers. They keep working, struggling, compensating, filtering toxins from your blood until they literally can't anymore, and by the time you feel symptoms, you've often lost 70–80% of your kidney function. At that point, we're not talking about prevention anymore. We're talking about survival. But here's the good news. Kidney disease is highly preventable, and even if you already have it, it's often reversible in the early stages. By the end of this video, you'll know exactly how to protect your kidneys, what warning signs to watch for, and what simple tests can tell you if you're at risk right now. But I'm not just going to throw medical jargon at you and hope you remember it, because if I do that, you'll click away thinking, "That's interesting," and never actually get tested. You need to understand why your kidneys matter so much, how they fail silently, and what you can do starting today to protect them. Before we begin, think of someone you know who has diabetes, high blood pressure, or heart disease. Someone who hasn't had blood work in years. Share this video with them right now. What you're about to learn could literally save their life. Let me tell you the rest of James's story because it's probably happening to someone you know right now. James was a retired accountant, active enough, played golf once a week, had type 2 diabetes for about 15 years, managed with pills. His blood pressure was a little high, but his doctor said it was acceptable for his age. He took his medications most days. Skipped them occasionally when he felt fine. Didn't think much about it. He hadn't been to a doctor in 12 years. "I felt good," he told me later. Why would I go if nothing was wrong? But something was wrong. Terribly wrong. For over a decade, his diabetes had been slowly, silently damaging the tiny blood vessels in his kidneys. His blood pressure, acceptable by old standards, was high enough to cause chronic stress on his kidneys' filtering units. Week after week, month after month, year after year, his kidneys compensated. They worked harder. They filtered toxins even as they lost capacity. By the time James finally got that blood test, he had 18% kidney function. "What does that mean?" he asked me at his first nephrology appointment. "It means you've lost 82% of your kidney capacity," I explained. "Your remaining kidney tissue is working overtime to keep you alive, but it's failing." James stared at me. But I don't feel sick. Not yet, I said. But you will. Soon. And he did. Within 3 months, James started feeling exhausted all the time. His ankles swelled. He lost his appetite. He felt nauseous after eating. His skin started itching uncontrollably, a sign that toxins were building up in his blood. 6 months after that first blood test, James started dialysis. 3 times a week, 4 hours at a time, hooked up to a machine that did the work his kidneys could no longer do. His life became defined by dialysis schedules. He couldn't travel. He couldn't eat most of the foods he loved, too much potassium, too much phosphorus. He lost weight. He lost energy. He lost years of his life. If I'd known, James told me one day during a treatment, his voice thick with regret, I would have done something. I would have gone to the doctor. I would have taken my diabetes seriously. I would have controlled my blood pressure. He looked at me with tears in his eyes. I didn't know I could lose my kidneys and feel nothing until it was too late. Here's why kidney disease is so devastatingly silent. Your kidneys have massive reserve capacity. You're born with 2 kidneys, each containing about 1 million tiny filtering units called nephrons. But here's the thing. You only need about 20–30% of those nephrons to feel completely normal. That means you can lose 70–80% of your kidney function and still feel fine. No pain. No obvious symptoms. Nothing. Your remaining nephrons work harder, compensate, and keep you going until they can't anymore. By the time you start feeling symptoms, fatigue, swelling, nausea, shortness of breath, you're usually at less than 20% kidney function. At that point, you're in stage 4 or stage 5 kidney disease. You're approaching kidney failure, and your treatment options are limited: dialysis or transplant. This is why routine blood work is non-negotiable after 60. You cannot rely on how you feel. Your body will lie to you. Your kidneys will fail silently. The only way to catch kidney disease early, when it's still preventable or reversible, is through blood and urine tests. 2 simple tests. That's all it takes. Test number 1. Serum creatinine and GFR. Your doctor will measure creatinine in your blood. Creatinine is a waste product from normal muscle metabolism. Your kidneys filter it out. When your kidneys aren't working well, creatinine builds up in your blood. Higher creatinine does lower kidney function. But creatinine alone doesn't tell the full story. That's why labs also calculate your GFR, glomerular filtration rate. Think of GFR as your kidney function percentage. James's GFR was 18. He was in stage 4, approaching stage 5. If he'd been tested 5 years earlier, his GFR might have been 40 or 50. Still concerning, but treatable, reversible potentially. But he didn't know, because he didn't get tested. Test 2. Urine albumin to creatinine ratio, ACR. This test measures protein in your urine. Normally, your kidneys keep protein in your blood where it belongs. But when kidney filters are damaged, protein leaks into your urine. The more protein in your urine, the more damaged your kidneys are and the faster they're likely to decline. Even more important, protein in your urine dramatically increases your risk of heart attack and stroke. Why? Because your kidneys are vascular organs. They're packed with blood vessels. They receive 20% of every heartbeat's blood flow. When your kidney blood vessels are damaged, your heart blood vessels are likely damaged too. Kidney disease and heart disease go hand in hand. This is why we say, your kidneys are a window into your cardiovascular health. Stop right here. Comment below when you last had blood work done. Be honest. Was it this year? Last year? 5 years ago? 10 years ago? And do you know your GFR number? Most people have no idea. And that's exactly the problem. But doctor, you're thinking, there must be some signs, something I'd noticed before it's too late. There are, but they're vague, easy to dismiss, easy to blame on just getting older. Let me walk you through the symptoms James did have, but ignored. Symptom number 1, fatigue. I'm just tired. I'm 68. Of course I'm tired. But this wasn't normal tiredness. This was bone-deep exhaustion. The kind where you feel drained even after sleeping 10 hours. Why? When your kidneys fail, they stop producing a hormone called erythropoietin, EPO, which tells your body to make red blood cells. Fewer red blood cells. Anemia. Crushing fatigue. My ankles are puffy. Must be the heat. But it wasn't the heat. It was salt and water retention. James's kidneys couldn't eliminate excess sodium anymore. so it accumulated in his tissues, especially his lower legs and feet. I get up to pee 3-4 times a night. That's just my age, right? Not necessarily. Damaged kidneys lose the ability to concentrate urine. That means you produce more dilute urine and have to urinate more frequently, especially at night. In men, this is often blamed on an enlarged prostate, and sometimes it is the prostate, but sometimes it's kidney disease, or both. I'm just not hungry lately. Food doesn't taste good. When toxins build up in your blood, because your kidneys can't filter them out, they affect your digestive system. You feel nauseous. Food tastes metallic or bland. You lose weight without trying. My skin is so dry and itchy. Must be winter. Nope. Uremic itching is one of the most miserable symptoms of kidney failure. Toxins accumulate under your skin, causing relentless itching that no lotion can fix. I get winded easily now. I'm just out of shape. 2 reasons for this. First, fluid can build up in your lungs when your kidneys don't eliminate excess water. Second, anemia means less oxygen delivery to your tissues. Do you see the problem? Every single one of these symptoms is vague and easy to dismiss. Tired, you're older. Swollen ankles, you've been on your feet. Peeing at night, prostate. Not hungry, stress. Itchy skin, dry winter air. Short of breath, out of shape. James dismissed all of them, for years. And by the time he couldn't ignore them anymore, his kidneys were nearly destroyed. So what causes kidney disease? High blood sugar damages the tiny blood vessels in your kidneys. Over time, this destroys the filtering units, nephrons. Type 2 diabetes is the most common cause simply because it's more prevalent than type 1. If you have diabetes and your blood sugar isn't well controlled, you are at extremely high risk for kidney disease. High blood pressure puts chronic stress on the blood vessels in your kidneys. Over years, this causes scarring and loss of function. The irony: kidney disease also causes high blood pressure, so it becomes a vicious cycle. High blood pressure damages kidneys, damaged kidneys raise blood pressure higher, further kidney damage. Blockages in the arteries supplying your kidneys, renal artery stenosis, reduce blood flow and damage kidney tissue. Ibuprofen, naproxen, Celebrex, these drugs are called NSAIDs, non-steroidal anti-inflammatory drugs. Chronic use, especially in older adults, can cause permanent kidney damage. If you're taking these daily for arthritis, chronic pain, or inflammation, you need to talk to your doctor about alternatives. We usually recommend acetaminophen, Tylenol, instead for patients with kidney issues. In men, an enlarged prostate can block urine flow. This causes back pressure on the kidneys, leading to damage over time. In both men and women, kidney stones or tumors can cause obstruction, cause the sex, recurrent kidney infections, repeated UTIs, urinary tract infections or kidney infections, pyelonephritis can cause scarring and chronic damage. The most common is polycystic kidney disease, PKD, a hereditary condition where fluid-filled cysts grow in the kidneys, eventually destroying normal tissue. If you have a family history of PKD or kidney failure, you should be screened. Cause: 8. Inflammatory kidney diseases, glomerulonephritis. This is a category of autoimmune or inflammatory conditions that attack the kidney's filtering units. Comment below, do you have any of the major risk factors? Diabetes, high blood pressure, family history of kidney disease, chronic NSAID use? Be honest. This is your wake-up call. Here's the million-dollar question, or, as I like to say, the billion-dollar question: how do you prevent kidney disease? The same way you prevent heart disease, stroke, and most chronic diseases. Prevention strategy. 1. Control your blood sugar. If you have diabetes, this is non-negotiable. High blood sugar is the number 1 cause of kidney failure. Target: A1C below 7% for most people, though your doctor may adjust based on age and other factors. See the earlier video discussion on this. How? Take your diabetes medications consistently, monitor your blood sugar regularly, eat a low-sugar, low-carb diet, exercise regularly, lose weight if you're overweight. Target: below 130 HORA80 for most people, lower if you already have kidney disease. How? Take blood pressure medications as prescribed. Reduce salt intake. Yes, salt matters. I'll address this in a moment. Lose weight. Exercise limit. Alcohol. Manage stress. But doctor, I've heard salt doesn't matter. That's a myth. No, it's not a myth. Salt absolutely matters, especially if you have high blood pressure, heart failure, or kidney disease. Here's why. Salt causes your body to retain water. More salt, thus more fluid retention, with higher blood pressure. More stress on kidneys and heart. Not everyone is equally salt sensitive. Some people's blood pressure skyrockets with salt. Others don't respond as dramatically, but if you have kidney disease, heart disease, or high blood pressure, you need to limit salt. Target less than 2,000 BNAL in sodium per day, ideally 1,500 mg/hours. Obesity increases your risk of diabetes, high blood pressure, and kidney disease. Losing even 5 to 10% of your body weight can significantly reduce these risks. Prevention strategy. Number 5. Exercise regularly. Aim for 150 minutes per week of moderate activity, brisk walking, swimming, cycling. Exercise improves blood sugar control, lowers blood pressure, supports weight loss, and improves cardiovascular health, all of which protect your kidneys. Smoking damages blood vessels throughout your body, including in your kidneys. If you smoke, quit. It's one of the best things you can do for your kidneys and your heart, lungs, and overall health. Heavy drinking can raise blood pressure and contribute to kidney damage. Limit to 1 drink per day for women, 2 for men. This is huge. So many people pop ibuprofen or naproxen daily for arthritis or chronic pain without realizing they're slowly destroying their kidneys. NSAIDs reduce blood flow to the kidneys, cause fluid retention, raise blood pressure, and can lead to permanent kidney damage with chronic use. If you have pain or fever, use acetaminophen, Tylenol instead. Talk to your doctor about safer alternatives for chronic pain. Get annual blood work, including serum creatinine and GFR urine albumin to creatinine ratio, ACR, fasting blood sugar, or A1C cholesterol panel. Know your numbers. Track them over time. If your doctor prescribes medications for diabetes, high blood pressure, or cholesterol, take them. These medications don't just treat the primary condition, they also protect your kidneys and heart. Recent advances in diabetes medications, SGLT2 inhibitors, GLP-1 agonists have shown remarkable benefits in slowing kidney disease progression. Doctor, if I already have kidney disease, is it too late, or can I reverse it? Great question. The answer: it depends. Reversible kidney damage, urinary obstruction, enlarged prostate, kidney stones. Remove the blockage, and kidney function often improves significantly. Medication-induced damage, NSAIDs, certain antibiotics. Stop the medication, and some function may return. Acute kidney injury from dehydration, infection, or temporary blood flow issues. Often reversible if caught and treated quickly. Partially reversible, preventable from progressing. Early-stage diabetic kidney disease. Tight blood sugar control can slow or even halt progression. Early-stage hypertensive kidney disease. Blood pressure control can stabilize kidney function. Obesity-related kidney disease. Weight loss can improve function. Advanced kidney disease, GFR below 30. Damage is permanent, but we can slow further decline. Polycystic kidney disease. Genetic, progressive, but newer medications can slow cyst growth. Chronic glomerulonephritis, depending on type, may respond to immunosuppressive therapy. The earlier you catch kidney disease, the better your chances of stopping or reversing it. If you're at stage 1 or 2, GFR 60-89, aggressive lifestyle changes and medication can often stabilize or even improve function. If you're at stage 3 or 4, GFR 15-59, we focus on slowing progression and preventing complications. If you're at stage 5, GFR 15, we're preparing for dialysis or transplant. This is why early detection is everything. Here's something that shocks most people. If you have kidney disease, you're more likely to die from a heart attack than from kidney failure. Let me say that again. Kidney disease patients die from cardiovascular complications more often than from their kidneys. Why? Because your kidneys and heart are intimately connected. Your kidneys receive 20% of your heart's blood output with every beat, are packed with tiny blood vessels, depend entirely on good blood flow to function. When kidney blood vessels are damaged from diabetes, high blood pressure, etc., your heart blood vessels are almost always damaged too. This is why we see a heat map effect. Low GFR plus high protein in urine far dramatically increased risk of heart attack, stroke, heart failure, and death. The worse your kidney function, the higher your cardiovascular risk. This is why treating kidney disease is also cardiovascular disease prevention. When we control your blood pressure, we protect your heart and kidneys. When we control your diabetes, we protect your heart and kidneys. When we prescribe certain medications, ACE inhibitors, ARBs, SGLT2 inhibitors, we're protecting both organs simultaneously. Your kidneys are not just filters, they're a window into your overall cardiovascular health. Doctor, my dad had kidney disease. Does that mean I'll get it too? Not necessarily, but you are at higher risk. Polycystic kidney disease, PKD, is the most common genetic kidney disease. It's inherited in an autosomal dominant pattern, meaning if one parent has it, you have a 50% chance of inheriting it. If you have a family history of PKD, you should be screened with an ultrasound or CT scan. We can see the cysts and track their growth over time. Other genetic factors: you may inherit a genetic predisposition to diabetes, high blood pressure, vascular disease, certain inflammatory kidney diseases. But genetics is only part of the story. Environment and lifestyle matter enormously. You can have a genetic risk for diabetes but never develop it if you maintain a healthy weight, exercise, and eat well. You can have a family history of high blood pressure but keep yours controlled with lifestyle changes and medication. Genetics loads the gun. Lifestyle pulls the trigger. Let me tell you what happened to James. After starting dialysis, James's quality of life declined significantly. 3 times a week, 4 hours at a time, hooked to a machine. He couldn't travel. He couldn't eat freely. He was exhausted constantly. But James was fortunate in one way. He had a daughter who offered to donate a kidney. After extensive testing and preparation, James received a kidney transplant 18 months after starting dialysis. The transplant changed his life. His energy returned. His appetite came back. He could travel again. He felt like himself. But he'll be on immunosuppressive medications for the rest of his life to prevent rejection, and his cardiovascular risk remains elevated. I'm grateful, James told me at his 1-year post-transplant appointment. But I'll never stop regretting that I didn't take care of myself earlier. He paused. If I'd just gone to the doctor. If I'd just controlled my diabetes. If I'd just known. That's why I'm making this video, so you know. So you don't end up like James, regretting the years you lost. Here's what you need to remember. 1. Kidney disease is silent until it's advanced. You can lose 70–80% of kidney function and feel completely normal. The only way to know is through blood and urine tests. 2 simple tests can detect kidney disease early: GFR, glomerular filtration rate, your kidney function percentage. Normal is 70–100. Urine ACR, albumin to creatinine ratio, measures protein in urine. Higher protein, GARS, more kidney damage and cardiovascular risk. 3. The biggest causes of kidney disease are preventable. Diabetes, control your blood sugar. High blood pressure, control your BP, reduce salt. Chronic NSAID use, switch to acetaminophen. 4. Kidney disease is often reversible or preventable from progressing if caught early. Early-stage kidney disease, GFR 60–89, can often be stabilized or improved with lifestyle changes and medication. 5. Kidney disease dramatically increases your risk of heart attack and stroke. Treating kidney disease is cardiovascular disease prevention. 6. The same healthy habits protect your kidneys, heart, and overall health. Control diabetes and blood pressure. Maintain healthy weight. Exercise regularly. Don't smoke. Limit alcohol. Reduce salt. Avoid chronic NSAID use. See your doctor regularly. 7. Know your numbers. What's your GFR? Do you have protein in your urine? When was your last kidney function test? If you don't know these answers, make an appointment today. If this video opened your eyes to the silent threat of kidney disease, please share it. Share it with anyone who has diabetes or high blood pressure. Share it with anyone over 60 who hasn't had blood work recently. Share it with anyone who takes ibuprofen or naproxen daily. This information could save their kidneys and their life. Subscribe to this channel because we're bringing you critical health information that your doctor might not have time to explain fully in a 15-minute appointment. Now, comment 3 things. When you last had blood work done, be honest. Whether you know your GFR number, your biggest kidney health concern, I read every comment, and I'll respond with specific advice for your situation. The action steps you need to take this week. Call your doctor and schedule blood work if it's been more than a year, or if you've never had kidney function tests. Ask specifically for GFR and urine ACR when you get tested. Review your current medications with your doctor, especially if you're taking NSAIDs regularly. Start one healthy habit this week. Reduce salt, increase exercise, improve blood sugar control, or lose 5 pounds. Your kidneys are working silently right now to keep you alive. They're filtering toxins. They're balancing fluids. They're producing hormones that keep your bones strong and your blood oxygenated. They're doing all of this without asking for anything in return, until they can't anymore. Don't wait until you're James, sitting in a dialysis chair, wishing you'd acted sooner. Your kidneys are trying to save you. Return the favor. Get tested. Know your numbers. Take action. It's never too late to start protecting your kidneys, but the sooner you start, the better your chances of keeping them healthy for life.